Hi, and welcome to Queen City Skin Podcast. This is your host, Dr. Elizabeth Roston, board-certified dermatologist, skin, nail, and hair specialist, and cosmetic expert. This is your place to learn about skin care, skin conditions, and the latest cosmetic techniques and services. Empower yourself with skincare and anti-aging knowledge for healthier, more beautiful skin and appearance. The information in this podcast is not for medical advice. It is for informational purposes only, and you should always consult with your doctor for your best care. Happy 2023 and welcome to Queen City Skin Podcast. I thought today we'd talk about some New Year's resolutions. I don't know if you make them. I tend not to. I might resolve to do different things throughout the year, but for some reason I tend not to make New Year's resolutions. Maybe I should. But when I think about New Year's resolutions, I know a lot of people think about getting their body in shape and losing some of those holiday pounds. So I thought we'd talk about how Charlotte Skin and Laser can help you meet that New Year resolution of a better body. We have a number of non-invasive fat removal devices. One of them is CoolSculpting. And most of you have probably heard of CoolSculpting. It is cryotherapy where the fat is frozen and destroyed. Cold or freezing the fat destroys it. So it's got an applicator and it sucks the unwanted fat up in the applicator and then cools it for that treatment cycle. It'll treat about 25% of the fat in that unwanted area. So you'll get about a 25% reduction with one treatment. We use the new CoolSculpting Elite that was mentioned in last month's podcast on hot topics of 2022. And one of them was the CoolSculpting Elite, which is more efficient, faster, and better than the previous CoolSculpting. We also use radio frequency, and that can be paired with the CoolSculpting. That one is Vanquish. And Vanquish is a field radio frequency, and it looks like a platform or a wing stretched over your unwanted area of fat. And it delivers radio frequency energy to the fat that heats and destroys it. So instead of freezing it, it heats it. It can be a great device for kind of debulking abdomen and flanks because it does wrap around. It treats a big area. CoolSculpting treats a grabbable area. You have to be able to grab it because it gets pulled up in the applicator. Vanquish treats a larger area, and sometimes it's nice to debulk a larger area before we get in there with CoolSculpting or our laser treatment to reduce. Our laser treatment also uses heat, and that's a 1064 laser, and we have the Lutronic Bliss, and that uses laser applicators on the skin that deliver high energy, laser energy into the fat while the surface is cool so it doesn't burn your skin. And that one's nice because, again, with CoolSculpting, you've got to have a grabbable, pinchable area of fat. And sometimes that's just hard, like on the side or on the flank. And in these hard-to-reach areas, the Bliss can be very, very helpful. Outer thighs, areas of tighter skin where it doesn't move a lot. This applicator stays on the skin, and we're not relying on pliability or movability of the fat. If you feel like or Tiffany downstairs feels like you're not a great candidate for any of these, or you just kind of want a more definitive treatment, I also offer tumescent liposuction, and that's done here in the office under local anesthesia. The word tumescent comes from tumescing the area with dilute lidocaine and fluid. So it kind of fills up the area of fat, and it also constricts the blood vessels, making it a bloodless and safe procedure. And then the cannula goes back and forth through the fat to remove the unwanted fat. Great for problem areas. Many people, particularly with yo-yo diets, they keep getting weight gain in their thigh or their abdomen, but they don't lose it there. And so every time you yo-yo, more weight goes to the outer thigh or the abdomen or inner thigh. And then when you lose, you don't lose it there. And liposuction can help even that out. Remarkably easy. And no general anesthesia or anything like that. We just give you a little something to relax you. And it's all done under local anesthesia. And it actually can be kind of fun because we talk during the procedure and things like that. Well, once you get the fat reduced, you you may want to tighten up your muscles. And I know a lot of people have New Year's resolutions in the body department just to get fit, to get in better shape. Well, AccuFit can help you do that. AccuFit uses electrical stimulation of muscles to help tighten and strengthen muscles in an area. Thighs, abdomen, buttocks, arms, and it does it way more efficiently than any of us do at the gym. So it's like a month's worth of training at the gym you get in a cycle of 4 AccuFits. It can also help you recover from a long period of inactivity, such as an injury or surgery, or just rest from a minor injury. AccuFit can help restore that muscle strength and tone, and I find that it helps me work out better at home. So I love it. I do it on my abdomen, and it really helps me with my core strength, and I can maintain at home. My core strength now after AccuFit is probably 10, 20 times better than it was before. It's really remarkable. And I rely on my core strength for horseback riding. So I'm very grateful for AccuFit. And I'm also grateful because I've previously found sit-ups and ab exercises very, very challenging. But because AccuFit puts you ahead of the curve, gives you that start, it's easy to maintain at home. So that's the main reason I love it. Well, let's talk about skin and New Year's resolutions for skin. I'm going to suggest a New Year's resolution. How about starting or keeping up good skincare? Sometimes in the winter, I hear from my patients that their skincare routine they kind of forget about and it just kind of dwindles off. Well, I would encourage you to still keep up your antioxidant, your retinol, your daily sunblock, even in January and February and March, even though the sun is not intense. You're still getting oxidative injury from the little bit of sun that's there, but also our screens, our computer screens and our phone screens. And we want to keep that process going. Some of the products you can probably drop in the winter include bleaching creams or creams designed to prevent pigment. You might save that for the peak summer months, but the other products, I think it's good to keep up year round. And if you're not on a good skincare routine, I encourage you to make that commitment. We're happy to do a skincare consultation. The things that we recommend as basics do include a daily sunblock, a retinol like tretinoin or over-the-counter retinol. Those are called retinoids. They help protect collagen from breakdown. And an antioxidant, vitamin C, vitamin E, ferritin, resveratrol, green tea. These prevent oxidative injury when you go out in the sun. So you go out in the sun creates free oxygen radicals, as does pollution and smoke. And having an antioxidant on board prevents oxidative injury to the collagen in your skin. Another suggestion for a New Year's resolution, and I've become more vocal about this, is maybe it's time to address your thinning hair. And I think the reason I've become more vocal about it is over the years I've noticed women taking such good care of their skin and they're getting neuromuscular relaxers like Botox and they're keeping up filler. But as I observe them and take care of them for years, I recognize that their hair is thinning and thinning hair looks old. But in 2023, we've got a lot of ways to treat thinning hair. And we address it nutritionally. We can recommend supplements like Viviscal Pro. We can prescribe medications like finasteride and minoxidil. You can use topical treatments at home. We often recommend the Revion Red Light Cap that features 2 wavelengths of light that stimulate increase blood flow in the scalp to support hair growth. And we offer in-office treatments, Keralase, which is a laser treatment paired with a proprietary growth serum. The laser itself stimulates hair, and it also increases the permeability of the skin so that the serum gets in better. And so you have a home serum to use as well. And then we do injections of platelet-rich plasma, the PRP injections. So my message is hair thinning, hair loss is treatable, and the sooner you treat it, the better. The better we're able to prevent additional loss and turn it around and grow more hair. So I say make a New Year's resolution to address your thinning hair if you've been thinking about it, because there are a number of ways we can address that. Another New Year's resolution that I'd like to throw in, particularly after the pandemic. I think a lot of people have caught up, but we got behind, and I'm just going to tell you, get your skin checked. Come in and get your skin checked, get your moles checked, get that taken care of, and we can give you an assessment and give you an estimate on how often you need to keep that up. But we don't want a skin cancer to sneak up on you, and so get your skin checked. So my wishes for you in the new year and suggested New Year's resolutions. Let us help you get your body back in order and tightened up. I encourage you to keep up or start a good skincare plan. Address thinning hair if that's something you've been thinking about, and get your skin checked. Thank you for tuning in today, and I look forward to seeing you in 2023. Happy New Year, everybody.